they have a slightly different approach. The Lancet, the Commission on Diagnostics, is a commission of the main Lancet, and it's formed by, here you have the publication. It was made in 2021. Here you have the members. Of these members, that I don't expect you to read all of them, we are 6 radiologists giving our input in the results of the Commission. And it's also interesting to say that Rifat Atun was also a member of this commission. So most of the data that was used in the Lancet Oncology Commissions was quite similar to the one we used in the part of imaging in our commission. So my intention today is just to go very rapidly through the recommendations of the Commission and what we pretend to do in the next couple of years, to make all of this information meaningful and helping the member states and the decision makers at the global level in order to improve the use of the diagnostics in general and, in my case, the imaging in particular. Regarding the definition of diagnostics is a component of medical devices. This is important because it's under the umbrella in all of the global discussions of the medical devices. And for the purpose of the resolution we are willing to be approved in the next World Health Assembly, includes both the in vitro and in vivo diagnosis. In vivo imaging and other medical devices use it in clinical encounters, and in vitro tests and samples of fluids and tissues. Recommendations that were published at the national level. These recommendations are to create a national diagnostic strategy, make tests for key conditions available to all primary care centers. This is a clear trend to reinforce the primary care. Invest on workforce expansion upskilling. After the data presented by Andrew Scott, you will see that it's a huge work to be done in this particular part. Commit to regulatory frameworks. There are not many. Roll out a national financing strategy. Improve the affordability of diagnostics. Develop the use of technology in a way that would benefit everyone, and address the needs of populations living in conflict situations. And more specifically, what we are doing now is to try to increase the recognition and funding for diagnostic, supporting the World Health Assembly resolution on diagnostics as a key first step. This resolution has to be approved in a couple of months in Geneva. And now we're also working with other partners in establishing an international diagnostics alliance to support and monitor all of the above recommendations. Not easy to get this resolution to be considered at the next World Health Assembly. For this, we had to work to find out a country to sponsor that. The country was the Kingdom of Eswatini, the former Swazilandia, close to South Africa. And we succeeded in having over 5 co-sponsors that had proposed this resolution on diagnostics for the forthcoming World Health Assembly. Secondly, we get in contact with 2 institutions, non-governmental institutions, FIND and CHAI. I will be more specific of this, in order to support financially the creation of the International Alliance for Diagnostics with the help of the Lancet Commission. In our case, I'm sure the Lancet Oncology Commission will be also happy to participate in this endeavor. Also the WHO has established the Strategic Technical Advisory Board on Medical Devices. And imaging, we are willing to have imaging as a major component of this medical devices resolution, to complement the existing one in vitro diagnostics. You have to know that imaging is not yet in the essential diagnostic list of WHO, and is not yet in the strategic technical advisory groups. And we want to get into the industry in these discussions, and we plan to organize a roundtable around the WHO Assembly. What about the resolution contents? The resolution was proposed, as I said, by the Kingdom of Eswatini. All of the 152 executive members of WHO decided to recommend the World Health Assembly to adopt this draft resolution to strengthen diagnostic capacity and will be discussed in a couple of months in Geneva. The co-sponsored by all of countries Afro-region, Indonesia, Germany, Bangladesh, France, also stated their support, and potentially, and hopefully, others will follow. The text of the resolution urges the member states and requests to the Director General of the WHO to take various steps and to report this progress in 2025. You have the draft of this resolution is accessible in the website of WHO, and I will give you a brief summary of the contents of this resolution. We use this AAAQ framework for summarizing the aspects of this resolution. That main goal is to achieve the universal health coverage globally, and the solution to the proposal has to be available, accessible, acceptable, and including quality and safety as a part of these proposals. The overall proposals for the member states are to consider establishing a diagnostic strategy, to consider develop the national essential diagnostic list. Remember that we don't have that at the global level yet. And to commit resources to research, development, and global production. We have had a meeting this morning with Dina Hassoni with the AFRA initiative goes exactly in the similar direction. For the Director General, at the higher hierarchy, we are proposing to have collect data and availability, access, and affordable for the diagnostics, support the member states in having this national essential diagnostic list, and to develop a kind of horizontal transversal health services to approach diagnosis, avoiding silos. There are quite a lot. And rapidly review evidence for the new diagnostics across several diseases. Inform policy about data collection and market shaping, invest in diagnostic services, and to strengthen the international collaboration including pandemics. Here the bodies, international bodies like the ISR has a strong paper here. And for the Director General to collect data, to support the member states in a good procuring good quality, affordable diagnostics, categorize subsets of WHO essential diagnostic levels, especially to emergency situations. We're having quite a few in these moments in the world, and to develop the data definitions for the Executive Board session in January, February in 2 years' time in order to follow up on these proposals. In terms of availability, which is crucial, leverage international and regional harmonization for regulation and manufacturing, invest in workforce, including measures to reassess and funding agreements on research and development, and for the Director General to support the member states on these regulatory systems for diagnostics, link the WHO electronic platforms in vivo and in vitro to provide comprehensive diagnostic services, and to publish these informations on W model list in vitro and in vivo. Extend, as I said at the beginning, the diagnostic patches and make it available at the point of care. This means primary care. Use the measures to job and develop technological transfer. Take into account the TRIPS. TRIPS is related with the intellectual property of different companies that are made by the World Trade Organization in order to waive some of these intellectual properties to use technology in developing countries, and constantly measure prevent anti-competitive practices. In terms of accessibility for the Director General, to support in procuring good quality affordable diagnostics, and to support the member states on request measures to take transferred to these countries. In terms of quality, commit to safe use of diagnostic imaging, and for the Director General, updating the essential diagnostic list, including medical imaging and other medical devices, support the development management of diagnostic imaging, including maintenance and disposal, this is very important, and to develop to strengthen regional global networks to implement quality management to ensure safety and quality in diagnosis. We are now also trying to progress in build up an international alliance for diagnosis. Discussions are ongoing, and to bring together national governments, regional organizations, international funding organizations, professional organizations, and the private sector. For this, we are in contact with this organization, FIND. Just to remember you that the funding for the Bill and Melinda Gates Foundation helps a lot on the work of the Commission, the Lancet Commission on Diagnostics, and they're also behind the FIND, and the Clean Health Access Initiative also accepted to support this initiative. There are a couple of updates of WHO regarding the medical devices. One is the selection and use of essential in vitro diagnostics, where imaging obviously is not there, and the compendium for innovative health technologies for low resource settings, where imaging starts to be there. I think it's going to be important. We had on the Commission roundtable with the industry in January 2020, preparing the Lancet Commission report, and it went quite well. We're trying to get another one roundtable in June this year in order to discuss how to achieve more equitable access to diagnostics, and even to help to ask them to enforce them to have a specific technology for lower middle-income countries. And this probably will be convened in Geneva. And that's it. I will be happy to answer any kind of questions. I think there's a lot of information in it, but I would like to give just an overall approach of the Lancet Commission on Oncology, what we're facing for the near future. Thank you very much for your attention.
Thank you, Professor Donoso.